Hello everyone, welcome back to Vishavaidya YouTube channel. Coming to the topic dog bite management. Once the virus infects the central nervous system and the clinical symptoms appear, rabies is fatal in 100% of cases. That means the person who is showing the clinical symptoms will definitely going to die. However, the rabies deaths are preventable with a prompt post-exposure prophylaxis, that is PEP, by stopping the virus from reaching the central nervous system. So, by proper care, PEP care or post-exposure prophylaxis, the rabies virus can be prevented by reaching the central nervous system. If a person is bitten or scratched by a potentially rabid animal, they should immediately and always seek PEP care. What do you mean by PEP care? What it includes, we are going to see in next slide. PEP consists of thorough wound washing with a soap and water and application of antiseptic solution, then administration of a course of human rabies vaccine, and when indicated, rabies immunoglobulins should be administered. WHO and its global partners aim to end human death from dog-mediated rabies through a comprehensive One Health approach by promoting these things, that is mass dog vaccination, ensuring access to PEP, health worker training, improved surveillance, and bite prevention through community awareness. So mass dog vaccination will control the spread of rabies. Ensuring access to PEP care can be prevent the transfer of rabies virus from infected area to central nervous system. Health worker training will improve the health accessibility to the common people. Improved surveillance will help in statistics and controlling the rabies virus. Then bite prevention through community awareness so that the community will be aware about the dog and the rabid dog signs, everything, so that the people will be away from the infected animal. Coming to dog mediated rabies. Rabies is a vaccine preventable. It is a vaccine preventable, mind it, and a zoonotic viral disease affecting the central nervous system in up to 99% of the human rabies cases. Dogs are responsible for virus transmission. In 99% of the cases, human rabies cases, the main culprit is dog. So the main thing is mass dog vaccination. Children between the age of 5 to 15 years or 14 years are frequent victims. Rabies infects mammals including dogs, cats, and livestock like cattle, sheep, pig, chicken, horses, etc., and wildlife. Rabies spreads to people and animals via saliva, usually through bites, scratches, or direct contact with the mucosa. By this type of bites, scratches, only 99% of the rabies will be transferred to the community. So once the clinical symptoms appear, rabies is 100% fatal. Once you are going to see the clinical symptoms, the patient definitely will going to die. Rabies from sources other than dogs. Bat-mediated rabies is also an emerging public health threat in Australia and parts of Western Europe. Human deaths following exposure to foxes and other wild mammals are very rare, and bites from rodents are not known to transmit rabies. So, the bat-mediated rabies is upcoming public health threat in Australia and parts of Western Europe. The contraction of rabies through inhalation of virus containing aerosol, consumption of raw meat or milk of infected animals, or through organ transplantation is extremely rare. Human to human transmission through bites or saliva is theoretically possible but has never been confirmed. Okay, so